Good, how are you?
Do you want to sign in?
Sure.
Hi, Ms. Jukov. Do you want to come back?
Yeah, thanks.
Tripod man is ready.
Hey there.
How are you all doing?
Good, how are you doing, Dr. Rob?
Good to see you all.
I know, it's great to see you too, as always. You look great.
As did you all. What can I do for you?
Well, actually, it's funny you should say that. All right, here's the situation. We've been talking. And, you know us, you know me, you know I'm an energetic person, and I feel really beautiful, but I keep looking in the mirror, and the person who's looking back at me in the mirror is not me. It's like somebody who's about 10 years older than I am. So really what I wanted to talk to you about and figure out what we could do is, I want my outside to match my inside.
All right.
So how can you tweak this back 10 years?
Well, that's a great question. We see that all the time. Well, what are the first things that bother you the most? I guess that's the first place to start. If you say you're walking by a window and all of a sudden you catch your reflection, you think, oh, those things bother me. What are the top 3 things that catch your eye and bother you?
Okay, I would say the top 3 things are these crazy little lines right here.
Okay.
Because I smile a lot and they're always there. And then this ditch I have between my 2 eyes.
Okay.
Can I add more than just 2 or 3 things?
Absolutely.
Okay. Like these right here. And then when I smile, I have these crazy wrinkles here.
Okay.
And also, I'm starting to notice these little tiny lines right here.
All right.
Which is really kind of freaky to me.
Yeah, those lipstick bleed lines. Not pleasant, not attractive.
Yeah, and they just started showing up. And then the last thing is, right here, I've always had dark circles, I'm Italian, but it just seems like they're getting a lot worse. And I keep trying to cover them up with makeup, and it's not working.
Well, you've just described probably the most common things that everybody sees as they age, and unfortunately we're all going to continue to age, but there are a number of things that we can do. Skincare. I mean, skincare is always a good starting place, and it does help to even out skin tones. And as I look at your skin and watch you animate, you have dynamic lines and wrinkles, which are a lot of the areas that you're describing, and that we usually treat with Botox because it helps rebalance the face, which is a beautiful thing. And if it's done really, really well, it can create a nice contour to the face. It will leave expression, but not leave you so.
Good, because I am dynamic,
Yep.
but I don't want to wind up with frozen face or drooling down one side of my face.
Oh, no.
You see all the horror stories.
Yeah, no, shouldn't happen. Some of the issues you talked about here, the circles under your eyes. One of the things that we see with aging is volume loss, and we see it across multiple layers of the face. The skin surface, the epithelium gets thick, and that kind of gives us that ashen, irregular, pebbly surface look, and that goes back to the skincare side of things. But the dermis, that starts to thin out. The soft tissue, the fatty layer, that starts to thin out. Even bone starts to change a little bit, and that leads to a little tilt on the face, which then leads to loss of structural support. And that's essentially what's going on in this area. We've started to lose volume in this region, which creates a more apparent look, and in some of it's shadowing, and some of it's contour irregularity, some of it may be a little bit of vascularity, but more than that, it's just some volume deficit, and for that we have other nice things like Juvederm, which is one of my favorite things. There are a number of fillers out there, but for this particular area, that's a great product to use. Kind of the same thing from your standpoint. If you were to catch your reflection in a mirror and you're like, oh, I don't want to see that, what would it be? Those right there? Okay. Maybe those bunny lines on your nose?
You have bunny lines.
Always fun.
Yeah. Guys should never have bunny lines.
That's a really small needle.
It is. It's a very
Can't
small
even
needle.
see it.
Nope, tiny little needle.
Wow.
Most patients barely even feel this.
Awesome.
All right. So first thing I'm going to do is I'm going to have you furrow your brow for me. Okay, relax. Pinch. Pinch. Squint and furrow for me. Okay, relax. Pinch. 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 Okay,
So
squint
you have a
for me.
lot of power in that little needle, don't you?
We do, we do.
Is that why like different injectors? Why like some people can have? Because I've heard of some people where they go to certain people to get injected, and it's totally different than going to somebody else.
I think it's an art to look at a face and assess a face from a motion standpoint, from a balance standpoint, and then be able to help create what the patient's really looking for. Male muscles tend to be a bit stronger than female muscles, and so we have to take that into account. So we tend to dose a little bit higher for male muscles. All right? So I'm going to have you furrow your brows for me a bit right here. Okay, relax. Pinch. Pinch. All right.
Thank you so
Absolutely.
much.
Fantastic.
Thank you.
Fantastic.
Thank
I can't
Always
wait
love
to-
seeing you.
Yeah.
It's a pleasure pain kind of thing, though, to be honest with you.
I have a great profession. I can inject needles and people still say thank you.
That's right.
So just let me know in the next 2 weeks if everything looks how we expect it to look. If there
Okay.
are any irregularities, we'll make sure they get corrected, and we'll look from there. All right.
Awesome.
Fantastic.
Thanks so
Great
much,
to see you all.
Dr. Rob. You too.